Let's enjoy studying and student life with proper fear. This video is presented by Tadao Isaka, Vice President, Ritsumeikan University, and Hiroshi Ito, Director of Ritsumeikan Medical Service Center. How does COVID-19 differ from the cold we know?
Common colds are mostly caused by rhinoviruses and cold coronaviruses. Symptoms of upper respiratory tract inflammation occur and resolve naturally in a few days. COVID-19, on the other hand, is highly virulent and can cause a variety of symptoms by infecting not only the upper respiratory tract, but also the whole body, including the lungs, heart, blood vessels, and digestive tract. Infection, especially in older people and those with underlying diseases, can be severe and result in death. In addition, there may be long-lasting effects including fatigue, taste disturbances, and hair loss. Most people have no immunity against COVID-19, thereby causing this explosive pandemic. Normal colds do not cause pandemics. Thus, coronavirus is quite different from a cold.
The basic rules for prevention include washing and sanitizing our hands, always wearing a mask, keeping physical distance, and avoiding the 3 C's. Why?
There are 3 routes of infection for this virus. 1. Contact infection. 2. Droplet infection. And 3. Microdroplet infection. Contact infections can be prevented by washing and disinfecting your hands and by not touching the mouth or face with the hands. Droplet infections can be prevented by wearing a mask and securing physical distance. Microdroplet infections can be prevented by avoiding the 3 C's in addition to basic preventative procedures such as masks. If you adhere to all these basic rules, you will not be infected.
What do you have to pay attention to in research labs and classes?
First of all, if you feel ill, please rest. Visit a medical institution for testing if necessary. If you adhere to the basic rules of prevention in class, you will not be infected by others. Or if, for instance, you are infected, you will not give it to other people.
What is important to remember in everyday life?
You don't need to worry too much if you're complying properly with the basic rules. However, we are forced to take our masks off temporarily when eating or drinking, so we become vulnerable. Eating during lunchtime and drinking fluids during breaks are dangerous. By removing your mask and talking to someone, or eating and drinking without washing your hands properly, you become at risk of infection. Please take your lunch in silence and allow yourself to eat quickly. People tend to converse while eating and drinking together, so be especially careful. We must also be vigilant during our daily lives at home or in the dormitory. At home, it is not realistic to wear a mask and live according to the basic rules. It is important for each and every family member or individual dormitory student to make the utmost effort to prevent the virus from being introduced into their homes from the outside.
It is said that young people, such as students, are unlikely to become seriously ill. What do you think students should be careful of?
First of all, I want to point out that there are cases in which even young people become seriously ill and die. Don't take this illness lightly. It is true that in young people, cases of COVID-19 are often said to be mild. However, do not misunderstand the meaning of mild. Just because mild cases of coronavirus infection are not severe enough to require hospitalization does not make it the same level as the common cold. It seems to be quite painful. In addition, even mild symptoms may have lasting effects, such as alopecia and taste disturbances. On the other hand, some people do not have any symptoms and do not notice the infection. Transmission may occur in people who do not notice any symptoms. In addition, viral shedding begins 2 or 3 days before the appearance of symptoms, and some data suggest that 40% of infected patients are infected by completely asymptomatic persons. It is important that everyone observes the basic rules, and for those who are asymptomatic to have the consideration not to infect others. Be careful not to endanger your parents, teachers, or the people at your part-time job.
What is the definition of a close contact?
A person who comes into contact with the patient's body or bodily fluids directly or at a distance of 1 meter or less without any necessary infection control measures, such as a mask, for a total of 15 minutes or more. If you adhere to the basic rules of prevention, you will not become a close contact. Infection may occur without close contact, but it may be considered very unlikely. Close contact was originally an expression that was used to define public sanitation measures, but it can be used as a guide for us to avoid risks in our daily lives. If you become a close contact, even if your PCR test result is negative, you will self-quarantine at home for 2 weeks to observe your health. Even without actual infection, the impact on schoolwork and work is enormous. In this sense, observing the basic rules is not only necessary for the prevention of new infections, but also for the prevention of new close contacts.
Are there things to be careful of when commuting to school or work?
Strictly observe the basic rules of prevention. Since commuting around rush hours tends to create crowds easily, making the effort to reduce risks such as moving the time you commute, opening windows for ventilation, and selecting empty vehicles is important. Hands that have touched hanging leather straps or handrails must be thoroughly washed or disinfected after getting off the vehicle. Until now, there have been reports of infections occurring in vehicles, such as airplanes, long-distance buses, tourist buses, taxis, and boats. However, as far as I know, there has been no case of infection occurring during the commute to or from school or work. This is probably due to the fact that many people observe rules, such as wearing masks and refraining from conversation, as well as the short ride time. It seems to be relatively safe. It is basically not necessary to self-quarantine for fear of commuting risks.
What do you think about club activities?
Strictly observe the basic rules of prevention. Full contact sports and competitions that require the removal of masks pose an increased risk. Some athletic associations have established and operate their own rules, so please review and follow them. Keep masks on as much as possible during club activities. If you need to remove the mask for a competition, follow the student office's instructions to minimize the time you need to remove the mask. In changing rooms, people often forget to be careful and tend to talk without masks and crowd the space. Be careful. Teams are just like families. Once someone is infected, it spreads throughout the team. It is important to be firmly responsible for your own actions after the club's activities are over, and to make every effort to ensure that each member of the club does not catch the virus and bring it into the club.
Please tell us what you should do when you feel sick at university.
At first, please do not go out for any reason. On weekdays, during the daytime, 9 o'clock to 5:30, send an email to APU Health Clinic detailing your symptoms. On weeknights, weekends, and holidays, those living at AP House should consult their house's caretaker. Those living in Beppu City should call Oita Prefecture Coronavirus Consultation Center. All others should call the nearest medical center.
Please tell us what you should be aware of if you want to get PCR testing.
If a doctor considers it necessary for diagnosis due to symptoms, the patient is entitled to undergo an administrative examination at a medical institution. Although medical examination costs are expensive, PCR testing costs are handled by the government, so you can receive it at no personal cost. On the other hand, asymptomatic patients who wish to undergo tests because of personal needs are considered optional tests. It is available for a fee at private medical institutions. Because a PCR test determines the presence of the virus at the time of testing only, a negative result does not mean you no longer need to be careful. False negatives are also possible.
Please tell me what you have learned from the situation at Ritsumeikan.
To date, fewer than 90 students, faculty, and staff members at Ritsumeikan have been infected. The cases in the 2 months of December and January alone account for 60% of the total number of people who have been infected to date. To date, there have been no cases of severe infection among students. As of November, eating and drinking, karaoke, etc. accounted for more than 60% of the infections. Since December, the additional infections have been attributed to spread within families and daily life. About 20% of cases occurred while eating and drinking, which is around the same percentage of those which occurred during other everyday life activities. All family members must observe the basic rules. In our school's case, contact in the laboratories, lecture rooms, or in group work, etc. did not result in close contact, and thus no cases of infection. No cases of close contact or infection have been reported in our administration offices either. As long as everyone wears a mask, close contact is not possible by definition. On the other hand, there were cases in which close contact occurred just by having lunch together, and 2 weeks of self-quarantine was necessary. Although there was no infection, it was a significant impact on studies and work. It is necessary to ensure that people eat their meals in silence and alone.
In order to reduce the risk of infection in the workplace, there are cases in which employees take turns working remotely or work in another room for 2 weeks after a business trip to a high-risk area. What are your thoughts on using this approach in the offices of this university?
I think taking turns working remotely is effective in curbing the flow of people in the city where there is a state of emergency declaration. However, if you are doing so to reduce the risk of infection at your place of work, it's almost meaningless. This is because if everyone wears masks, the risk is low to begin with. Even if vaccination begins in the future, this condition will continue for about a year or so. While it is necessary to continue to enforce the basic rules of prevention, excessive countermeasures may hinder education and work.
What is your outlook for the future?
At present, the number of new infections is steadily decreasing after the state of emergency declaration, but the number of new deaths is still increasing. Although the rate of hospital bed use and the number of people who are seriously ill have begun to decline slowly, it may take the entirety of March to reduce that number significantly. Antibody testing of the general population was performed recently in places like Tokyo and Osaka, but antibody prevalence was still less than 1% in all regions. Positive rates of 60 to 70% are required for population immunization, but we are far from this. Acquisition of mass immunity by vaccines is thought to be the only key to a resolution. However, there are numerous challenges for smooth immunization, so it is hard to predict what will happen. Even if we are able to acquire mass immunity through vaccination in Japan, it will probably take at least 1 year. The current situation will continue until then. Even if the third wave subsides, depending on government measures and people's actions, we have good cause to expect a fourth wave to begin somewhere in the new fiscal year.
As the spread of corona infection continues, Director Ito, you say proper fear is important. What do you mean?
Viruses are invisible to humans. Consequently, this fact tends to cause excessive fear and anxiety. Fear is important because it leads to prevention. However, excessive fear and anxiety disturb our judgment and behavior. They can stall our lives and lead to discrimination against infected people. Rather than just fearing invisible things, I think it is necessary to have proper fear or scientifically assess the risks. If we follow the basic rules, there will be no infection, and we can continue our educational and research activities.
Thank you for watching.